Welcome to a global conversation sponsored by the Center for Innovation and Global Health. I'm Michelle Berry. I'm actually the director of the center, and it's my great pleasure this early evening, well, actually it's late afternoon, to introduce both Dr. Madhu Pai and Paul Costello. Madhu, as we affectionately call him, is really a global health leader and foremost advocate for global health equity. His research really revolves on improving the diagnosis and treatment of tuberculosis, both in high resource settings as well as low resource settings. He is the Canada Research Chair in Epidemiology and Global Health at McGill, and he's also the Associate Director of the McGill International TB Center. He may be a TB doctor, but his passion is really about health equity and really being a voice for health equity around the world. He serves on many advisory boards, many WHO TB advisory boards. He's very well published. He's got over 350 publications. And he's also a new editor of a new journal, PLOS Global Public Health, which is an interesting thing. We can talk about that as well. And I'm very excited for this conversation. We had a fabulous class, for those of you who were in my class earlier this morning, where we heard quite a bit about his passion. And just for his medical training, he trained in velour, for his internal medicine and community medicine training. And for those of you who don't know velour, it's really the top university, medical university, one of the top in India. I would argue it's the top, but we can argue about many things. He earned his PhD in epidemiology at Berkeley, and then went on to do, interestingly, a fellowship in UCSF and pulmonary and critical care. Anyway, I'm looking very much forward to this conversation with also Paul Costello. And Paul, for those of you who don't know him, served for 16 years as our communications officer at Stanford School of Medicine. And he's also now adjunct faculty in the Department of Medicine. And we're very happy to have him as a Global Health Faculty Fellow at the Center for Innovation in Global Health. He has run many of these conversations. And I have to warn you, Madhu, he goes straight to the heart. Heads up, full transparency, and enjoy the ride.
Thanks, and thank you everyone for joining us. We've been doing these over Zoom, as you can imagine, for the past couple of years. And it's been horrible. I teach a class on leadership and ethics, and that's done in the School of Medicine, that's done on Zoom. And you never know if somebody's in the room, if they've taken the dog for a walk, etc. So I'm glad to see all of you here, and you're not taking your dog for a walk today. And thank you for the opportunity to speak with you. I wanted to start with, I listened to your lecture today in class, in Michelle's class that you talked about. And I was listening to the content, but I was more interested in the emotion. And what drives you? What's the emotion? What's the passion? And where does that well come from? What is it? I couldn't tell if you were angry, disgusted, maybe all of those things. But can you talk a bit about where all of those emotions and feelings come from when you talk about the inequity in the world between the global South and global North?
Thank you, Paul. Thank you, Michelle. Wonderful to see so many people. But you're right, it's very hard to bring people into a room these days. We're all still very comfortable with the online world. So it's wonderful to see so many people here. So I think anger is probably, anger and disappointment is what I would say are my two overriding emotions. More so, I think, during this last 3 years. I feel like as a global health community, we have failed repeatedly on equity in this last 3 years. And the consequences have been catastrophic for a lot of communities, right? And I can't understand why we cannot walk the talk on things that we say, right? For example, how many political leaders, including in Canada, where I'm from, said all the right things. We are in this together. We're not in this together, right? We prioritized ourselves again and again and again. We couldn't care less about other countries. Closing the borders became more important than saving lives. Protecting big pharma became more important than giving life-saving technologies to people who are desperately asking for it. And so I've kind of become quite cynical about many of the things that I'm seeing, because the talk is simply not being reflected in anything at the level of the ground. But my own work is more to do with my positionality as a double agent, right? You told me you
What does that mean?
Yeah, so somebody once called me on my face that I'm a double agent. And for my first reaction was, this person is cursing me, right? It doesn't sound like a very pleasing thing. But then they said, oh, you lived and worked in India for many, many years, and now you're in North America, and therefore somehow you're able to bridge two worlds, right? Or at least see what the realities are from both sides, right? And I think that is true, and I now proudly wear the badge of being a double agent. I don't have a problem with that.
But what does that allow you to have that double agent status? What insight does it give you that it doesn't give to white people, to white global health people? What do you talk about that?
First, I don't want to kind of somehow make the claim that I'm somehow better than others. That's not what I'm trying to say. I do have lived experience of living and working in rural India, which certainly helps me hold my own in any setting, right? Secondly, I understand the realities of the gap between what is happening in Washington, D.C. or Seattle or New York or Ottawa and what actually hits the ground, right? So I can see the enormous no-do gap in global health, right? All the talk in Geneva and what actually translates on the ground in a rural area in India. I've seen it, I've lived it, right? So I kind of know and understand that. More than that, right now being where I am, I'm not in India, I'm a full professor in Canada. I now have this weight of privilege on me because I'm now no different than anyone else, right? I'm part of the global health elite, if you wish. So I ask myself, what do I do with that privilege, right? At a minimum, I can use platforms like these to call out the BS within global health here, right? Because nobody can do anything to me at this stage, right? I have the privilege, I'm unafraid to use it. Mm-hmm. And what is the worst thing anybody can do? They can block me, they can uninvite me, which is fine with me. Doesn't bother me at this stage. I can certainly use that privilege to say things that somebody in the global south may be scared to say. So to that extent, I think this is actually a great place to be, and I hope many more double agents will use that privilege.
So what are the things that you can say here tonight that someone from the global south couldn't say? What are the things that you can bring to this room and the people here that others can't say?
Exactly what I spoke in the class this morning, that global health is dominated by people like us. Not the people who truly are the most disenfranchised, those who know the most, they are not in the driver's seat. People like us who are far away from the real problems are the ones who are the most elite, and we dominate global health. I had a graphic in my talk this morning on what I call the global health defaults. The default setting in global health is global north, which is us, men, white, powerful and privileged, right? All of us are part of that ecosystem. I don't see myself at all outside that framework, right? I'm part of the global health default. I enjoy all of the privileges. We can publish, we can lead panels, we can be on commissions, we get to decide who gets the vaccine and who doesn't. It's an enormous privilege that we all hold. And it's hard to not to talk about privilege sitting in this building, in this university, right? This is the apex of privilege, right? So question is, are we the right people? Should we be the ones deciding, making life or death decisions for people who truly are very, very far away from here and who have the most lived experience, and they're usually not in the building, certainly not at the table, definitely not in leadership roles.
You
Right?
talked about at a conference on HIV/AIDS.
Oh man, that was Montreal. I'm ashamed of Canada. I'm sorry. It was brutal.
Okay, so tell us about that.
I mean, I don't know whose bright idea was it to hold an AIDS conference in Canada last year. The Canadian government pretty much decided that they're not going to allow people from Africa to come to Montreal for the AIDS conference. So we had empty chairs on the panels. The entire panel canceled because not a single participant was in the building. And this was like a slow-moving train wreck that we actually saw coming, right? We tried everything. We wrote to the immigration minister, we wrote to the prime minister, we did media, we did endless advocacy, nothing worked. And since then, every conference in Canada has been disrupted. People from low and middle income countries have not even a shot of getting the visa on time. And how is this country any different? US and Canada are the two most visa hostile countries in the world, right? UK, add UK to that list, right? Europe. So how do we claim anything is global when we are hosting meetings and events and panels which are designed to exclude people at this stage, right? Every time we organize anything in North America or Europe, you're basically saying, we're going to talk about you, but we are okay with you not being at the table. That's what we did. We told Africans, we're going to talk about HIV/AIDS. We know you're the most impacted continent in the world, but it's okay if your voice is not on the podium. How do you get away with that in 2022?
So how do you get away with that?
I'm at a loss. I'm seeing this carnage. Every conference is then. In fact, some people in Canada have written an op-ed saying Canada is no longer a safe place for international conferences. We've tried everything possible. How is this qualitatively different? The indifference we show, or the visa apartheid, how is it different from not sharing vaccines? COVID vaccines, how is it different from not giving the technology to countries that are asking for it so that they can make their own product? This, to me, is the structural problem within global health, which is why we can talk as much as we want about equities and inequities, but structurally, so long as global health continues to be dominated by privileged global north voices, nothing will fundamentally change on the ground.
You said this morning that you realize that there's a recognition now, at least a recognition
For sure.
of the inequities and the significance of the equities and the powerfulness of the equities. But the question now is, so what do we do about the inequities? So you're here in a crowd of people who care about mental health. What do we do, and what's the path forward, and what should educational, academic institutions like Stanford and where you are, McGill, be doing about those?
Great question. You're right. There are now reports after report that Wellcome Trust is structurally problematic, London School is problematic, MSF is problematic. Right? That blew my mind. MSF and Doctors Without Borders is a group that we would all look up to, right? It's like a Nobel Prize winning organization. They are saying, yeah, we agree. Structurally, we are problematic, right? So there are reports coming thick and fast. Look at all the sexual harassment in WHO, United Nations. Oh my God, that's like, really? So we've come to a point where we're willing to acknowledge that things are fundamentally messed up, right? So to me, that is still progress, because there is a report now that says, hey, London School of Hygiene is problematic. Published by them.
When you
okay?
say that the London School,
Not by me, right?
explain that. What the report said what?
Oh, London School, Liverpool School, Wellcome Trust, they are all now publishing reports that they've done independent audits
Inward books.
and they've found to be structurally racist, right? Their whole systems are structurally racist. And shouldn't shock us because these are all colonial legacy institutions, right? They all date directly back to colonial eras. And so when I was at the London School 3 weeks ago, there was a big discussion. Oh, we're going to change our name. We need to change our name. Tropical medicine sounds awful in 2023. I would agree, right? So whatever, it's their call to make on what they want to do with it or not. But how is this different from all of us after George Floyd's murder to say we have a problem of racism here in Canada, right? Europe. So we're willing to say, yes, that's a problem, right? Even on the racism side, there's plenty of reports saying, yeah, we agree, that's a problem, right? Where I'm seeing is how many of us are able to walk the talk on how to make any changes, right? It's one thing to acknowledge there's a problem. I think we're all reaching that stage, thick and fast, right? Hundreds of articles, reports, commissions, and whatnot. There was an entire Lancet series on racism and xenophobia, just published like 3 months ago, right? We've reached a stage, Lancet is now saying they are fundamentally, structurally problematic. I was in Lancet office at their invitation recently. So yes, we've come a long way in terms of our ability to openly speak about this, right? And I think that's because of Black Lives Matter, women and global health movement, right? The whole struggle for decolonizing global health. It's all come to a boil where everybody can see with plain eyes that this is structurally problematic, right?
So are we at an optimistic point because of that, because of seeing and knowing? Do you think we're at this point of optimism to change, that there is the knowledge of the institutional long-term racism, inequities, and now it's what do we do about it? And is there optimism, or is there, you said in the beginning you're sort of a cynic. So are you an optimist or a cynic or somewhere in between?
I think I kind of oscillate like this, right? There are days when I'm optimistic. There are days that I want to just throw in the towel and go home. And it's, I don't think anyone has been spared that kind of feeling during this 3 years, right? We've all been through horrible times. But I think we are certainly at an inflection point in as much as we're able to have public conversations like this, right? I'm not sure if you had asked me 10 years ago when I was sitting here, would I have said everything that I've said so far? Probably not.
Because?
Because I wasn't bold enough, or I wasn't mature enough in my thinking, or that I hadn't seen the kind of BS I've seen in the last 3 years. Mm-hmm. The BS that we see and our ability to call out the BS, I think, has gone up because it is so much in our face. So then next time somebody says, oh, we care about equity, I'm like, say, show me what you've done, right? Show me what you've actually done in practice and not just what you're talking about, right? So the answer to your question is optimistic in as much as we are able to have such, I don't want to say courageous conversations, honest conversations. Right? There's nothing courageous. Everything I've said is already well known. If you've been serious and looking at global health, you already know everything that I've said is factually true. It's a bit like, are we able to courageously talk about racism and anti-racism in 2023? I think the answer is yes. Mm-hmm. We owe that a lot to all the Black people and others who've raised that to our attention. Not that they hadn't done it before, we weren't paying attention to them. But now that we are all there, everybody, every university, including mine, has all these DEI pledges, right? We were all putting out pledges, thick and fast, right? Now, 3 years later, after George Floyd's killing, we need to have an honest conversations. How many of those DEI pledges have actually materially done anything concrete? Now it's time for audit, right? I think Black people are asking for that. They're saying, all of you who put stuff on your banners, on your Twitter feed, right, BLM, show us what you've done in actual concrete terms, right? When the rubber hits the road, same thing for decolonizing global health. That all you global North universities that have written papers, have done panels or whatever about decolonizing global health, tell us in plain language, what have you materially done to shift power away from the default positions of global health that we spoke about? And I'm not sure how good we will all look if that audit was done and a report card was given to us, right? Because it's one thing to put out a pledge, it's brutally hard and painfully hard to live up to that pledge, right? So I'm hoping this is the time when we get serious and say, yeah, we have a report that we are structurally problematic. Here is what we've done in response to that report. And we will give you an annual update so that you can hold us accountable for what changes we said we will do. I'm not seeing that level of insight or transparency in any organization for that matter, right? One can hope that will happen, but right now it seems like a lot of it is still talk and not enough action.
What's wrong with the model of the Gates Foundation solving problems and putting out funding vaccine trials? And what's wrong with that model of these private organizations that are fueling all of these great things that are really changing humankind? What's wrong with that model?
So I think I want to broaden that discussion to philanthropy or charity as a whole. Gates is only one of them. Mm-hmm. I was invited to speak at Wellcome Trust last month, and that's another huge charity, right? I think the realization for me is that no amount of charity can substitute for justice, right? Each of us individually, I'm sure you, me, all of us in this room, when there's a crisis, I don't know, flood in Pakistan, whatever, right? I go to Red Cross or MSF and I make a donation, right? Because I can see all these horrifying images and I'm like saying, let me do something. That's all good, right? There are days when I don't feel very charitable. I'm stressed. I didn't get a pay rise. I had a horrible annual review, whatever, right? I suddenly lost some money, right? My daughter threw the laptop into the toilet, whatever. I'm not feeling generous. So I stop. I'm saying health and health equity cannot be dependent on my mood, my charity, my willingness to do benevolence on a given day. Tomorrow, let's imagine Bill Gates wakes up and decides that he's going to close shop, right? He decides to close shop, or Elon Musk decides that he's had it and he's just packing up to Mars. He is packing up to Mars. But these people, as good or well-intentioned they are not a substitute for genuine building up of justice in this world.
I know, but it wasn't being done is the problem, is that yes, but it wasn't being done by governments. It wasn't being done, these resources came in because there were huge gaps.
So we had a conversation in your Michelle's class this morning, and I recommended to everyone that they read this book, Winner Takes All by Anand Giridharadas. Please read it. I have never seen a more beautifully written piece, a book, on what's wrong with philanthropy as a substitute for genuine democratic policies or processes. If these super wealthy people had just paid their fair share of taxes, that would more than enough to cover universal health care for the entire humanity. And they would still be left with multiples of billions of dollars of wealth. So to me, the Davos way of thinking about global health is that the super elite will meet in Davos and they would have flown in on their private jets and they will decide what to do about poverty or climate change, right? The sheer carbon footprint of these super elite is more than several low-income countries put together. That's data, right? So we have to ask ourselves, how did the world come to be that a dozen people have as much wealth as 4 billion people on this planet? And if we never even talk about those systems of inequity, right? I think economic inequity is the mother of all inequities, right? It's like the biggest driver that's looming on our heads, and it is not only showing up in unrest and conflicts, pandemics, inability to deal with crisis, climate change. They're all related, right? And I'm saying that sitting in Silicon Valley, which is like the mother of all capitalistic places in the planet, which say you can become as wealthy as you want, even if there are millions of homeless people in this place. How? At some point, you got to all wake up and say, there's something wrong with this picture, right? And Anand Giridharadas says The solution is not more and more philanthropy or charity, which can be turned on or turned off depending on somebody's mood, with no accountability of any structures, is to just pay your taxes proportionate to your income and be done with it.
But isn't it also, it's taxes and money, but isn't it also that there are not structures in the global south that can effectively operate large systems, that can effectively put together programs, that can effectively create a health system? Isn't that, I mean, how do we get past that gap, which is a huge gap? There are rulers who are, tyrants and thieves.
I'm happy you're asking me this question, because I can then counter by saying, so this is not just you, Paul. I've heard this so many times in so many fora. So Madhu, what about corruption, right? In low and middle income countries. Tell me this, Paul. In any other country, if a gun lobby had paid off every damn politician who does nothing, that would be called corruption. There is only one word for that. In this country, it's called something else. Lobbying, advocacy. Honestly, a child could tell you that's problematic.
Yeah.
In fact, children in America have taken to the streets because adults are not preventing them from getting slaughtered in their schools. Come on. My 15-year-old will tell you, this is effed up. Pardon my language, right? Because if I cannot imagine a world, my 15-year-old is right now in the US, in Washington, D.C. with her school. She's telling me, Dad, I'm scared. What if somebody starts shooting us up? And my heart is sinking. This is the first time she's gone anywhere. I'm texting her every half an hour. I'm being the annoying dad. I'm tracking her on my phone. She's pissed off with me. But I mean, look at the number of school shootings. I don't want to trivialize the pain that you all have, okay? You're living through this. And every one of you will know someone who would have been impacted by gun violence, right? So where in the world did we ever come to the idea that corruption is a global south issue?
But I think, I'm not making that case, I'm making the case that are there structures in place if you shift the philanthropy, the philanthropic endeavors, the Gates, all of these, how is that picked up?
I think it's a very legitimate question. So I was in Kenya in November of last year. There was an entire panel on anti-blackness in global health. I was the only non-black person on the panel. It was very hard for me. And they were having heated discussion. It's all on video. Watch it if you wish. So there are people on the panel, Black Africans, who are saying, Global North is seriously deciding what we should be doing in Kenya or Africa. We need to make our own policies. We need to run this ship. We need to manufacture our own products. We need to exercise our agency, right? As this was being discussed, some guy at the back puts up his hand and says, but what about all our corrupt leaders? So this is Africans talking to each other on the messed up leadership problem that they are facing. They are frustrated as hell in their own leaders. Then the discussion came that these are not mutually exclusive issues. Yes, Africa must get a better handle on their leadership crisis, as Nigerians tried to do. They tried desperately to save their country. Have you all seen the disappointment among Nigerians? They are in anguish. Like Brazilians fought for their lives recently, right? Every country finally needs to battle it out on their democracies and saving themselves. And that means going out to vote, to organize, to mobilize, so on and so forth. But that doesn't take away this north-south power dynamic that I'm talking about. Both need to happen, is the question, and they're not mutually exclusive. One does not preclude the other, right? So if you ask me, are there no examples of well-functioning health systems in the global south? Absolutely not. There are so many. Take Rwanda, take Thailand. India has done amazing stuff. China, the progress that they've made in alleviating poverty and the impact that's had is incredible, right? So there are countries, Brazil has done well, South Africa has done well. It's not impossible. And now they're saying we want to make our own vaccines in Africa so that they can be independent of us. They can be done with this charity model of global health, which they have seen repeatedly fails them.
So connect the dots between monkeypox, malaria vaccine, and COVID-19.
Well, to me, they're all examples of how the global north prioritizes itself again and again and again. Start with HIV/AIDS, right? When the antiretrovirals became available, we had the first access to it. And then it took, 2 decades for it to scale in Africa? How many million people got infected during that time? What did it do to the entire continent? The devastating impact on life expectancy? It set the continent back by decades, right? Look at COVID-19, same thing, same mistake, Mpox. You and I could have gone and gotten a shot here, but the entire continent of Africa had 0 Mpox vaccines. How do you pull that off? My mind is blown by that statement, right? Entire continent of Africa hasn't seen Paxlovid. You could have gone, I walked into Walgreens and picked up some here, right? It's like these repetitive stories. Ebola, nobody did anything for Ebola until white people started getting Ebola. And the investments increased by 1,000-fold, right? So that was a point I made in the pediatric rounds today. It's almost as if a disease doesn't impact people like us, it doesn't even exist, right? Somebody said, if COVID had only impacted Africa, they would have locked up Africa and thrown away the key. Yodi Alakija's statement, right, on BBC National. So this is scary. That the fact to me, I'm seeing a pattern here. That when this happens again and again and again, I don't blame chance. I say it's intentional. Right? Once you can say it's an oversight.
The intentional based on what? Talk about where that comes from and how that is created and how.
More than me, I think the Black Africans who wrote a piece in PLOS Global Public Health on anti-Blackness is global health, their voices need to be heard. They're basically saying, when we see this repetitive pattern, we think that we are at the bottom of the human hierarchy, right? White people in the global north are at the top of the human hierarchy. Black people in Africa are at the bottom of the human hierarchy, right? Certainly that was how the world saw them 100, 200 years ago when we felt that they could be bought and sold, right? Transatlantic slave trade. And today they're saying, we see this discrimination in the way that we have to wait till 2024 to get a vaccine. We have to wait till 2025 to apply for a US visa. What message are you sending us, is what they're asking. And I had no answers for them on the panel. I was just trying to hide. It was horrible. It was just horrible.
Is that anger coming? What is the emotion coming from? Is it fueled by anger, outrage?
Deep disappointment in all of the talk, right? Mm-hmm. We are all perfect when it comes to talk. Canadian government has mastered the art of talk. We are all in this together. I'm like saying, no, we're not. Right? I mean, I was on Canadian national television, CBC, National News. The anchor asks me, so Dr. Pai, why should Canada help other countries during this COVID crisis? I'm like saying, what do I tell you? Right? Well, because they are other human beings. Is that not good enough for you? Then I said, let's do it for selfish reasons. If we don't vaccinate others, those nasty variants will come here. That's global health security for all intents and purposes today. Global health security is a code for keeping those exotic pathogens away from entering our wonderful countries, right? That's the code for global health security. Because if it was really about those countries, then by now we would have done everything possible to give them everything that they need to fight pandemics. Tell me, in which world will it not be better for us? Right now, Tanzania is dealing with Marburg virus, okay? Imagine there was a vaccine for Marburg virus and Tanzania could make it themselves. Would that not be great for us? They deal with an outbreak, they're done with it. So having them empowered with all the tools that they need is wonderful for us. Otherwise, we deal with this mess for the 4th year in a row. In what world is this world that we are living in and what we've seen over the last 4 years has been good for us. We've bled money. We've lost millions of people. This country has lost 1.1 million people. How has this been good for us? And yet, when come times to action, we're like, yeah, we'll give you vaccines 2 years from now, right? How? I'm not getting it. I'm not understanding it, right? Nothing that we've done makes any sense for me from a rational, scientific perspective, epidemiological perspective, financial perspective, economic perspective. I once wrote a blog post on 10 reasons why we should vaccinate the world and be done with it. I thought one wasn't enough. First reason would be we're all human beings. End of discussion, right? No, that wasn't enough at all, right? Then I said the economic reason, look at the millions we'll save, right? All of that. None of that made any difference in the end. We've abandoned 2.3 billion people globally who haven't had a single dose of the COVID vaccine. Forget Paxlovid, forget boosters, forget Omicron targeting boosters. We're not even there yet. We're nowhere close to that yet.
Let me ask you a personal question about, take us back to Vellore, where you grew up. What is the child that is still in the man today? I often find that, we don't ever escape that part of ourselves. And what are the things that you hold dear that came about as you were a child growing up? What's still present today?
I don't know. Growing up in a small town, there was nothing there, right? So we just had fun. We went down, played cricket in 40 degrees Celsius weather. Nothing. It was a very uncomplicated life, right? Small town, uncomplicated life.
What were the core values that you learned at that point? Who were the important people in your life who helped you? I mean, I'm curious of how you became the person you are and how this passion. Not everyone has the passion, the determination, all of those things that you have, that you displayed. How did you come about that?
Well, I wouldn't say any of this was somehow stuff that I inherited from my childhood. No. I think it has taken me time to get there. And I think the last 3 years have been truly when I've kind of become very vocal about these issues. Because it's one thing to see it. It's a whole another thing to see it repetitively, and it's a whole another thing to see it being played out in the midst of the global crisis. And so to me, my anger and disappointment is easier to take it out now, right? And like I also said, I'm in a place of privilege, right? Nobody's going to fire me. I can say whatever I want. I'm okay. I hope my university won't fire me. But I think if there is a transformative moment, I would have to say it's what happened in India during the Delta wave crisis. It truly broke me. Not just me. I mean, there isn't any Indian in this room who wouldn't know what I'm talking about. To see a country just go up in flames almost overnight was like a punch in the gut that nobody could even think about. In 3 months, 3 million Indians are estimated to have died. That's when I sat up and said, holy shit, if this virus is allowed to just run through countries, it'll be a mountain of graves, that there is going to be no end to this. I kind of saw the devastating lethality of this pandemic at that minute. First year of the pandemic, it somehow didn't register to me. And I saw him after India instantaneously. Sri Lanka went into flames, Nepal went into flames, Bangladesh went into flames, Indonesia went into. I said, oh my God, we got to vaccinate people. It gives them at least a fighting chance, right? And when the dust has settled, that's what we know today, right? Low and middle income countries have borne the brunt of this pandemic. United States is the only high income country that's an exception. You folks didn't need this devastation. You had the resources, you had the wealth, you could have done much, much better, right? But in all other countries, it's not because they didn't want to, because they didn't have the right set of tools.
And why do you think we do? Why do you think we are so comparable to those places that had great devastation. What do you think about the American ethos that contributed to that?
How candid can I be?
Being very candid.
This is a devastatingly self-inflicted loss, just as the gun violence is a self-inflicted loss. Every other high-income country has figured out how to control guns,
Yeah.
like that. Took Australia like 3 weeks to nail this. Canada, done. Europe, unheard of. It's possible. It's possible. So you had all the tools at your disposal, and yet the political governance structures of this country, which then brings us to the point that, Americans now, as a community, will have to fight this battle here. Just as Nigerians are trying to protect their democracy, or Brazilians or Indians have to figure out what to do in India, that battle can only happen here, just as all of you need to fight for women's reproductive rights in this country again. Rights that were hard won. Right? When people have died securing those rights, and they've all been rolled back in a flash. Just as kids are getting out of schools to tell adults this is not acceptable. Right? They shouldn't be doing this, right? I don't want my kid running around the streets protesting against gun violence. I want her to be in school. I want her to be a child. Kids in this country have been forced to grow up way faster than they should. Right? They've seen devastation that you and I cannot even imagine. Right? So just to say that US has immense amount of work to do, and I think that was a discussion I had with Shazeen, that some of you who are passionate about global health must start focusing on the madness within too. This isn't about going 1,000 miles to some underserved places. There's a lot of stuff to fix here. Same thing in Canada. We have abandoned our indigenous communities whose health indices are almost comparable to what we would find in a low-income country. How? Why? Why should such wealthy countries have such deep disparities here? So some of us have to buckle up and say, we are in this fight and we're going to focus on health inequities at home. It's almost like, I'll stop there, I've been talking too much. It's almost like I ask myself, if you're not willing to do right by your own citizens, in Canada's case, indigenous people, how would you do right by somebody far, far away? Right? You got to start somewhere. In some ways, equity begins at home. And this is the only rich nation that does not believe in universal health coverage. Right? There's so many issues to deal with here. And I've been telling that to students, American students, when I give talks. They say, Professor Pai, we want to go do this here, there, and the other. I'm like, can you think of a country which doesn't have universal health coverage, serious gun violence, racial disparity, black moms have maternal mortality rate that's 4 times higher than others? Can you do something about that too? That is not an argument that you shouldn't be externally facing. I'm saying at some point, completely ignoring these disparities makes us feel disingenuous. If you're serious about equity, then you should see inequities everywhere, right? Even our global health courses need to evolve. We can't just teach about what's happening in Rwanda or Thailand or India. We've got to talk about what's happening here. That's when we start walking the talk, right? So some of us will work here, some of us will do both. Some of us are doing both, right? Michelle said she likes to do stuff here. Shazeen might do stuff here, but some of us will go elsewhere. We have to stop thinking that global health is low quality health somewhere else. And when we do that, we truly start centering on equity again.
Let me ask you a final question, then we'll take questions from the audience. Paul Farmer was someone who you greatly admired, and you had many conversations with him. And what's the legacy that you see as you tie everything you talked about tonight together? What's the legacy, and how did Paul Farmer contribute to the wisdom of this understanding of the inequities on the global front?
It's a great point. I mean, there are so many learnings from Paul's work. But the one thing that I wrote a Forbes piece about, and one that I spoke about in today's pediatric rounds is, Paul asked us to first counter what he called failures of the imagination. He said, if you can't envision or imagine a world, then you will not walk the path to getting there. Let's translate that to what I just said. Could we not have envisioned 3 years ago when the pandemic hit and we saw the devastation this was going to cause? Could we not have envisioned a world where the whole world was vaccinated? Just one thing, right? Whole world needs to be vaccinated. We're going to put down the money proportionate to the country's income. We're going to give the vaccine technology once developed to anybody and everybody who wants it. And we're just going to blanket the planet and give everybody the basic protection that they need. We somehow failed to think of that possibility. And everything we did over the last 3 years showed that we failed even at the level of the imagination, right? That's just one example. And Paul gives you so many such examples of how the first failure is a failure of imagination, right? If we can't even imagine equity, if we can't even imagine a world, can we imagine an America where kids can be safe in schools? That's imagination. Then you enact the policies and the democratic policies to realize that vision. But you got to start by saying, no kid in this country is going to get mowed down by an assault rifle when they're sitting in an elementary school. That is like the bare rock minimum imagination our leaders need, your leaders need, right? And convincing them that we can dream of that world because that world exists across the border. You don't have to go far. Just come to Canada and my kid goes to school with no fear of getting cut down in the middle of a lecture, right? It's not impossible, but start with that vision. And I think that's Paul's legacy. And secondly, he was just so bullheaded, right? When people told him, oh, you can't scale up ARVs in Haiti, he laughed at them. They said, well, you can't treat drug-resistant TB in Haiti. He did exactly that, right? I think his entire life was to show that if you wanted to do some serious work, if you're pig-headed and bullish to get it done, you can get it done, right? And that is, I think, the kind of ambition that those of us working in global health desperately need.
Thank you.
Can we take questions? I don't think we have a microphone, so can you stand up and shout? Does anybody have any questions? Yes.
Hi, it's nice to meet you. I'm a first year medical student here. My name's Zoe. And so my question was about the feeling of disappointment that you discussed, because I often find myself feeling disappointed as well, like not just with the pandemic response, but I think within global health, I think there's genuinely like a failure to empathize with what people are experiencing, which drives a lot of the inaction we see, despite us knowing the solutions and all this research we're producing. And so I wanted to ask you, who do you think this disappointment should be directed at? Should it be at individuals, since they are the people that make up these systems, right? Or should it be directed at the systems? Should it be individuals exclusively with power, like the richest people whose taxes have the potential to provide universal health coverage? Because, you know, like if someone's skipping, like declaring taxes on their $600 Venmo, I don't know, that's not going to do anything, but, you know, billionaires can. But, yeah, that's my question.
So it's a complex question. What I would say is, when I have this disappointment and anger, which I'm sure every one of you has or had, the first thing I think we should do is to find like-minded people, right? There is something to be said about collectively getting pissed off with the realities, right? Because individually, I've learned that no matter how good you are, great you are, what you are, like it was humbling for me. As a McGill professor, I had not even the slightest influence on anything Canada did. I did everything possible. Right? I tried to shame them. I went on national television. I spoke in the parliament. I wrote letters and op-eds and signatures campaigns. I did everything possible. I don't think anything I did mattered at all, right? That's very humbling, which means individually, I think we are very powerless. Even a Stanford professor couldn't do much, okay? So our only hope is to genuinely team up with like-minded people. That's what I think young people have learned very quickly. You would be hard-pressed to find a young climate justice person who's going solo. They invariably are found in teams. They find great solidarity with each other, and together, these young people are a scary force. They are devastatingly scary. And if there's anyone who's going to fix this gun violence, it's the young people. People who are least likely to do it are the old people, especially the old men. Do not expect change from them at all. I'm sorry, this has got nothing to do with anybody in this room. It is just the realities of what this world is looking like, okay? And so I wrote a piece in Forbes where I interviewed something like 25 young people from around the world. And I asked them, so what do you think about the way the world is dealing with this climate crisis and COVID-19? Boy, were they pissed off. They were like absolutely unfiltered, and it's all published, okay? And I was terrified, and they were consistent in their messaging. And they didn't know that I was contacting them. It wasn't like a group exercise, right? They were devastatingly clear in their diagnosis. And I asked them, who inspires you? I thought they'll say Paul Farmer, right? No, they said we get inspiration from each other. It's the young people inspiring each other that is likely to tip the scales in climate justice, in gun violence, reproductive justice, you name it, that's the future. So at a minimum, all the rest of us who are not young should either get out of their way or at least be decent allies to the young people. Give them the platform, elevate them, and because they are the ones who are going to take us. This also puts enormous pressure on young people. They are all on the verge of burnout. Mental health issues are devastatingly out of control, and they all have what they call climate anxiety. My 15-year-old says she's anxious about her future. She's not sure what is going to happen even 10, 20 years from now, right? And every COP report, it's devastating, right? Every climate conference, the timeline gets shifted. The world is already spiraling out of control on climate crisis. And everybody agrees who understands the science. You can't turn the clock back on this. And if anything, we're going to exceed the 2 degrees Celsius boundary much faster than we ever thought, right? So to me, you express your disappointment as an individual, for sure, whatever you can, but also by teaming up with others like you, then you organize, you mobilize. There's a beautiful book by a guy called Ben Phillips, How to Fight Inequality and Why the Fight Needs You. And there's a beautiful line in that statement. He says, the leader that you're waiting for is actually you. There's nobody else coming to save you. You get out, you fight for your justice, and that's exactly what young people are doing. They've given up on us. I say us, I mean adults. Really?
Say who you are.
Oh, hi, I'm Rajiv Bhatia. Public health, long career in public health, internist here. So like you didn't talk about the economics of health technologies or devices. So you sort of see where what drives innovation, drives innovation where the money is in this universe. It isn't necessarily, again, for common problems, solvable problems, increasingly esoteric. One, I think the question of how has any examples of changing the economic drivers for health investments and health innovation again, that's the system. The second, I think, thing is that when you talk about AR 17,
Whatever they
and killing kids at school, that's pretty simple to understand. Managing pandemic is complex, and the citizens of this country didn't have the capacity to participate democratically, make decisions, in my view, made quite undemocratic, whether of course that they were authoritarian, and there was no public discussion where I think that discussion and the empowerment of people could have been a force that drove. But thinking about more broadly, so where I can examples. Where are examples of capacity building, not just in institutions, but at grassroots level, understand the needs of their health?
Great question, Raji. So, in terms of innovation, I think I would love to bust this myth that innovations only happen in the rich global north. Okay, and I think you know this as much as I do. The sheer conditions in which I worked as an intern, right? I remember when I was a medical student intern, I didn't have enough needles given to me in the public hospital. I had to go and rinse it and use the same damn needle on half a dozen patients, and I don't know what damage I did by doing all of that. We worked in such adverse situations, and we sometimes did what we needed to do. We didn't even call it innovation. We just did it to survive, right? There's tremendous wisdom in communities that have solved complex problems just to survive, right? And we never call it innovation because it isn't coming from Silicon Valley, right? So let's be clear that innovation is happening in every country, and tapping into that and making it work for the health system is critical. The point you made, which I really enjoyed, was there's a lot of innovation happening here, but it isn't solving your healthcare problem, is it? Not necessarily equitably, right? Maybe for the wealthiest it is. So innovation that is completely inaccessible, should we even call it an innovation? A vaccine that is only for the elite and the privileged, is that really an innovation? When does something truly become an innovation? When it's actually reaching people, right? What's the point in having an insulin that's bankrupting you? Insulin, right? A trivial medicine that could have been given, that was actually given for free, and is still not accessible to an average American, then Americans have to come to Canada to buy insulin, right? This is not working. So to me, the putting innovations on a pedestal, we need to also start asking who is accessing these innovations, and is it really reaching people? The minute you bring that into the equation, suddenly we have a more sober response to the so-called innovation thing, right? So I think there's lots of innovation that this country needs to convert innovations into access. That's the real innovation, in my opinion. And you're right about public trust. I saw this devastating report from UNICEF that not only 67 million kids have missed childhood immunization in 3 years, vaccine hesitancy is skyrocketing in virtually every country. And that is a massive problem of lack of trust in public health systems. And how to struggle with that, and that needs to happen here as well, but also in other parts of the world. So public health people, all of us who work in public health, have to really rethink whether science alone is enough. If the science tells you vaccines work, that doesn't mean it's being accepted, or that doesn't mean it's being communicated in a way that makes sense to people. And the lack of trust because of this pandemic is having a spiraling effect on everything else in terms of acceptance of public health interventions.
Take one more question.
I'm Shazine. I'm a pediatrician in Philanthropy, also Canadian. And my question for you is on colonization of global health. My parents are refugees, and the reason they were refugees because directly of colonization. And we talk about poor infrastructure, we talk about corruption, and if we unroll that backwards, it is really because of colonialism. We talk about decolonizing public health, colonizing global health, but I think the conversation sometimes stops here at that word. I'm wondering if you can tell us, in your own words, unfiltered, what does that mean to decolonize global health?
So to me, decolonize global health is genuinely to shift power, right? Because everything I told you, everything, first of all, if this last 3 years has taught me anything, that health is deeply political, right? And political structures being what they are, they genuinely militate against equity, right? An average Canadian politician did not see any value in sharing that. Even though everything on the face of it, there were bulletproof arguments on what Canada should have done, just did not work out, right? So even in my global health class now, I'm now inviting politicians to come into my class. I had an MP, member of the parliament, come all the way from Ottawa to speak in my course, and my students were like, oh my God. And I have been so naive, right? It's like this pandemic was a slap in the face, right? No amount of great science, logic, argument can militate against this kind of broken politics. And the gun violence is a spectacular illustration, right? We know what needs to get done, can't get it done. Why? And finding a way to make this happen is also a public health responsibility, right? So those of us who are in public health needs to be very sober. To go back to your question, Shati, I genuinely think the geopolitical environment being what it is, I cannot see any way to decolonize anything, right? So long as we have a chokehold on this world, in every way, economic, geopolitics, just power, it is impossible to decolonize anything. The only little glimmer of hope that I ever saw was the reparations and the loss and damage in the climate discussion. The climate folks are asking very hard questions. They're saying, you global north countries caused this devastation. You are responsible for a gigantic amount of carbon emissions. You pay up. Where is the equivalent of that in global health? Right? There is no equivalent of that. At a minimum, we could have given the vaccines and the vaccine technology as an act of reparation. Right? For all the damage we've done here, we're paying for our past sins, right? There is no real discussion happening on that front.
Actually, there's a Lancet Commission reparations.
Yes.
So that's been going on for several months.
Yes,
Hopefully
Eugene's book is also along that theme. I think Paul Farmer also started thinking about that. Haiti is a good case study of the need for reparation, right? So I would love to see where that goes. But that's a very hard conversation. Because the minute you say, oh, I have to pay now, all our leaders are like frozen, right? Not one of them wants to go anywhere near that. So there are this Barbados Prime Minister, like Mia Murphy, like in your face, right? Where is all the thing that you owe us? There are a few global South leaders really calling out the PS. I don't see that happen much in global health.
Thank you.
I'm going to say, I think we have to end it at 6. I know this conversation can take place. I really sad to stop it. Doesn't have any questions. We have to leave. I want to thank both Paul and Matthew. And I also want to just say that these conversations are really imperative. I think we need to continue to have these conversations. Andrew's point about collective voice really important. Hopefully we can continue this in the future. Thank you very much.